Hi, welcome to Candid Chats on Cancer. I'm Mary Robinson.
And I'm Jamie Moore. Mary, who we have today, I am so excited.
I am too. We have Dr. Lisa Merrifield, and she's a clinical psychologist here in Omaha.
Welcome, Dr. Merrifield.
Thank you. I'm so happy to be here with you.
Yeah.
All right, we have questions that you can, we have a ton of them.
Lots.
Oh, great. Well, let's get started.
All right.
One of the things that we want to talk about is fear. Cancer people, it seems like from the minute we hear the diagnosis, you know, and the diagnosis itself, the word cancer is very scary.
Yes, it is a scary diagnosis to people, and you're right. Fear is a very common reaction to receiving that diagnosis, particularly because of the long history of cancer and the outcomes that now are much better. But sadly, cancer affects a lot of people, and it's increasingly prevalent in society. So people are now familiar with cancer in ways that if you backed up 20 or 30 years ago, maybe not, people were not as touched by it, had no quite as many people who were affected. But that fear reaction is usually with the assumption that things will go badly. And sometimes the outcomes are more favorable. And we've seen evidence of that in your previous guest earlier before me.
Yeah.
So I'm stumbling on my words a little bit here because fear is something to talk about. And when people are alone, when they feel alone, even when they're around other people, sometimes fear can take them to very scary places, and the mind tends to wander and get the better of them. There are techniques that you can use. There are ways that you can learn to call on your friends, that you can learn to lean on the people who are around to support you, and ways to cultivate habits of calling on the help that's available to help alleviate the fear that can really make life feel sweeter again and more comforting.
What are some strategies that you have in mind for somebody to overcome some of their fears?
Well, the first thing is to stay off the internet.
That's true.
You know, the internet can be, there's a wealth of information there, but it's, that's the problem. There's so much information there, and especially when someone's early in their diagnosis, it's hard to know what to make of all the information. So it's a little bit like drinking from a fire hydrant. I'm not saying never go to the internet, but in the beginning especially, it's really hard to know what's out there. And so to try to limit the amount of information that you're taking in, you want to be an informed consumer of healthcare services. You want to be able to partner with your doctor in a knowledgeable way, but it's really easy to zero in on the scariest stuff available, and there's a lot of it out there.
Right.
So number one is, you know, limit your time on the internet and limit the types of information that you choose to take in. Talking with other people who have gone through a similar process, who have dealt with a cancer that's similar to what a person is diagnosed with. Support groups can be helpful. Mileage may vary there. Some people are will feel strengthened and encouraged by support groups, and other people just find them dismal and depressing. And that's really sort of an individual variable. I mean, I think anybody who's running a support group, the group leader will help try to guide the support group. But yeah, I would think individual mileage may vary. That's the way. So I would say check it out and see what you think.
And I agree with that. I remember that when I was going to have my stem cell transplant, I did go to a support group that, just because it was for those specifically that have had stem cell transplants or were going to have one. And I thought, I need to see people that have survived this because I was really scared. I knew what was going to happen because of the prior leukemia, because I went through all those treatments, but I didn't know about the stem cell transplant part.
Yes.
And so for me, it was just phenomenal to meet people that were 12, 15 years out there, even a year out.
Yes.
You know, I'm like, wow, you know, people do survive. I can do this. And it kind of it lifted my spirits. But I agree with you. It depends on how the support group is facilitated. Yeah.
No, felt the same way, but the opposite way of Mary, I stayed away from the support groups because I didn't want to be around the doom and gloom. But I come in with a whole different mental aspect of it because I came from the hospital, so I had just exactly what you were saying. I saw the bad aspect of cancer. Mary is more, I don't know, positive?
Well, I try to be positive.
About things. And the support groups are really helpful.
But
for her.
I think it can be such a good thing for people to investigate. And, you know, I would encourage folks to, you know, think about whether connecting with other individuals who are going through a similar experience, or, as Mary mentioned, have gone through the experience and are a little farther down the road. Ask yourself, you know, am I the kind of person who benefits from talking to other people, or do I feel energized by giving myself in support of other people? And if so, then a group that is willing and able to touch on cancer, because some people are not comfortable talking about it. And when you're in a group that's designated for that purpose, then that's the ground rule, right? You're there to talk about living a good life with a cancer diagnosis and getting better and all that kind of thing. So I would encourage people to check it out and see if it's for you. And if it's not, just know that it's not everybody's cup of tea, but if it is your cup of tea, by all means. You know, anything that helps you feel stronger, anything that helps you feel more connected to the healing path that you're on, affirm it and do it.
Exactly.
And if it's not your cup of tea, don't worry about it. You know, there are other things that you can do.
What else can we do? I know we've talked about mindfulness before on the show. Can you elaborate a little bit on that?
Well, mindfulness is bringing into awareness, you know, how we're feeling in the given moment and how we're coping with things. And there are different practices that are associated with that. But I would say anything that enables you to learn to control your monkey mind, that just wants to take over and run your life. You know, the worries can just be like herding cats. It's really hard to bundle them up and get them to go in one direction. And when you can get your thoughts to settle and you can direct them in, even to a place that's benign, just a place where you can be with yourself and not be overcome with the worries and the fears, that's a very healing space to be in. And you know, mindful practice is certainly one way of doing that. Even something as simple as being mindful of the breath and the pace of the breathing, and even just the rise and fall of the chest as the air comes in and the air goes out. It sounds so simple, but in practice, it can help you hit a pause button and everything can just settle. And I use the word practice with that because it's not a one-time thing. Some people will say, oh, meditation is too hard. Well, it's not always easy when people first start. And meditation for some people can be a charged word. It has connotations of Eastern practice, but people meditate in church all the time, right? It's an opportunity to quiet the mind, to settle the body, to just be. And in that beingness, the fear can dissipate. And if you can't just let yourself be empty and still, then you can give your mind a job to do. You can let your mind count your breaths. You can let your mind plan your future. You can let your mind do just about anything, but give it a job, you know?
I like the idea about planning a future.
Yeah, that's
Because
really
I think
nice.
a lot of us that when you hear cancer, it seems like the future, the bottom of it just drops out from underneath you.
Yes, I would absolutely agree on that. I mean, when the diagnosis first comes, people they feel like they have to get busy. They have to get busy planning treatment. They have to get busy figuring out the child care while they go to treatment. There's lots of logistics involved. But after a while, it can take over a person's life so that it doesn't feel like their life anymore. It just feels like a big medical experiment. And that's not a knock on the medical practitioners. Nobody's looking for that to happen, but it does happen.
Right.
And really what you want to get back to is, you know, living while you're dealing with a cancer diagnosis, with the emphasis on the living and getting on with a life that you recognize and a life that feels satisfying. And if you can't do it today because maybe you're not well enough or maybe you're too busy going to treatment, but what are you looking forward to? And what's the life that's pulling you into the future? Because it's so easy for us to get anchored in the past. People have, when we get an illness, it's so tempting to think, where did I go wrong? What did I do? What was the trauma that caused this? We are always, it's just human nature. We want to know why. Mm-hmm. But that can only take you so far. Even if you were able to figure it out, like say somebody who gets lung cancer and they say, oh, I had asbestos exposure. Okay, even if they know that, right, which is a known risk factor, and they know they had the exposure, it's done. So there's only so much you can do by looking to the past. Right. But the future is before us. And having something that you're moving into, a life that's calling you forward, boy, that is just so valuable. And so I encourage people at night when they're going to sleep, if their mind is just still too active and they can't get it to calm, then I say, okay, well then put it to work. And put it to work on something good and something that you want to have in your life and something that you want to call into your life. I think it's an interesting exercise just to ask people to list 10 things. Not even 20, eventually advanced people, I'll say go for 20, but 10 things that you'd like to be, do, or have in the next 6 months. It's amazing how many people cannot do that. It's as though they get to a certain place in adult life and they're done, even though their life's not over, but they've quit thinking about it the way that people dream when they're younger.
Right.
Probably because they're taking care of kids, working, and they don't think too far ahead because it's the same old thing every day.
Right.
Maybe.
Treatment after treatment.
Yeah.
You just don't feel good. The idea of the future for me reminds me of hope.
Mm-hmm. Yeah, me too.
That if you sit down and write 10 things about the future, well, you have to have hope in order to be able to sit down and write those 10 things. Now, let's say that we're really, really sick, okay? Mm-hmm. My list of 10 things were very small. It would be more like 3. Help me make it through the day. Mm-hmm. Have somebody smile to me because that made me happy. And somebody loved me that day. Sometimes there was only 3, I couldn't even get to 10, but the 3 was, sometimes that was all I needed to get me through to that following day. Mm-hmm. So the future is hope.
Mm-hmm. Well, and also, and having something to look forward to as well. I know that every night my youngest daughter and I have 3 things that we're grateful for. So I come up with 3 things, she comes up with 3 things. It could be as simple as, I was just so excited that we had a nice meal. But some of the things that she comes up with, I'm just like, wow, she's really thinking about this. And I think going to bed with an attitude of gratitude or waking up with an attitude of gratitude, it just really changes your mindset and the way that your day could be going. So,
yes, I agree with you that gratitude is hugely helpful, and it's a wonderful practice for people to have at any time. It serves you well when you're healthy. It serves you well when you're sick. It's having a grateful heart will always make your life richer. And
so basically what you're saying, even just if we're normal, happy, healthy, just doing the 10 things and looking towards the future, hope towards the future, is just as good for if you're sick or if you have cancer.
It is good. I mean, usually when we're in our gratitude, it's about things that have happened already. So it's a little less about creating the future, but if you know what you're appreciative of now, usually we want more of that, right? We want usually affirm that going forward. So there's lots of things there's lots of ways that you can let that fear be crowded out by something better. Whether it's gratitude for what's already in your life, or whether it's attention going to the things that you want to see come into your life yet. And if someone is too physically ill to get up and do anything, like you said, there are other things that you can focus on that still happen. They can be in the interpersonal domain. The first time I tried to make the list of the things that I wanted to have in my life, what I found was it was a to-do list. It was getting caught up on the taxes. It was things like that.
That's
no, exactly. And so I was like, wow, Lisa, you need to pay attention to that. That all the things that I was going to first were things that were obligations. And they weren't really things that would bring me joy. They were just like getting a monkey off my back.
Right.
And that is not the same thing as joy. You know, and bringing more joy into your life can be something as simple as saying, I wanted to go to an orientation at the Do Space, for example. I wanted to see about using the 3D printer. It's been on my list for 2 years, and I finally did it 2 weeks ago. But it was so satisfying. You know, it's a small thing. It didn't even cost any money, right? I just had to make room for it in my life.
Right.
And I think I'm not the only person who's in that boat. I see it with my clients, not just the ones who have cancer, but I have seen it in my clients who had cancer.
Yeah.
You know.
Oh, and I think it's always so rewarding to check something off a list. You know, if you have a future of your, 10 items that are positive and you're like, oh, I finally did that.
Yes, the Grand
Yeah.
Canyon. It took me
feel
5 years to get to the Grand Canyon. I mean, I'm not moving fast here, but
No,
my
you're
God,
not.
it's happening.
That's all it counts, as long as I'm still moving.
Oh, that's great.
That's right. Well, some of the things are nearer term. You know, like you really want to have some things on the list that will not take you that long.
Right.
Yeah, exactly. That's funny.
But I often ask my clients, you know, let's say somebody is experiencing depression, whether they have cancer or whether they don't, but they're experiencing depression. And depression very often will sap a person's physical energy. They just have fatigue, they don't feel like doing anything. And my question is, when the energy comes back, what are you going to do with it? Because when it comes back, you want to have a place for it to go.
Right.
And so that turns out to be a very useful exercise for many people.
Well, what do you tell them to do to maybe start getting their energy back? I mean, do you just say, well, why don't you try some exercising or yoga? Or do you have other strategies for somebody that is depressed that maybe can't get out of their hump?
Well, yes, I would say individual circumstances would dictate what we would do. Some people are going to exercise class, or it's like they get a cancer diagnosis and now they have to be a perfect person. You know, they have to eat right and exercise regularly, and they go to the doctor regularly, and so sometimes people have already taken on a lot of changes in that regard, but they don't have the oomph. And sometimes it's a function of the treatment itself, and that's just an unfortunate temporary. Usually it's temporary feature of the cancer treatment. And so in those cases, you know, finding a way to be compassionate with oneself is especially for, boy, those busy moms, I'm telling you. It's not that men also, of course, are accustomed to doing. They're often more identified with the workplace. But for mothers, even if they're accustomed to working outside of the home, it's really what I see is when the energy gets low and the laundry piles up and the vacuum hasn't been run and the kids are eating peanut butter sandwiches, another lunch, you know, it's where they feel like they're falling off on their caretaking of the family. That is it's an additional burden. And learning to just be compassionate with oneself and saying, yes, I'm going to say yes to the help from the neighbor, or we're going to let it go. It does, you know, is it going to kill your kids to have peanut butter sandwiches 2 days running for lunch? No, it's not. And even coming to that sometimes, just deciding, okay, well, I can live with this, or you know, I don't have to be super mom. I want to be as good a parent as I can be, but you can't do everything.
So that was give yourself permission to slow down and heal.
Mm-hmm. I think for people to give themselves permission is a major step. But it's not always such an easy thing to do.
No, it's not. You do something very specialized in your office too, called neurofeedback or neurotherapy.
I do.
Now,
it's a psychophysiological technique that helps work directly with the body, with the stress response. So sometimes we're working with the brain waves, sometimes we're working with the frequency of the heartbeat. There are different physiological measurements you can use, but basically you can take someone whose physiology, that's the body, the operation of the body, has become atypical, and you can coach it back to behave more normally, and the person will feel better, like a person who's not ill.
Right. So it's like, you know, even post-cancer,
yes.
we suffer from a lot of anxiety, because we're always thinking, you know, like the what else. Like for me, my cat, I got a scan coming up here in a couple of weeks. Well, this is my first scan, and I'll be a year clean. but we have all this anxiety, especially afterwards when we're healing, you start any aches and pains. And so how does neurotherapy help anxiety? Or can it help anxiety?
The short answer is yes, it can help anxiety. I find that when there's been a situation like a major illness, it's not enough to work strictly with the physiology. You need an opportunity for somebody to talk, and they need to make sense of what they've been going through. I mean, the neurofeedback and biofeedback can be wonderful tools for helping normalize the way the body is responding to stress. And sometimes it can help me get people to a place I couldn't otherwise coach them. But I find that one of the things that people really require when they've gone through a life-threatening illness, or they're living with life-threatening illness, not everybody goes into remission, right? Some people live with cancer.
Yes.
And they can learn to live well and be happy with their lives. But they have to find their own meaning in that, and that's highly individualized, and it's deserving of some space to talk and to figure out for themselves how they want to handle things.
Do you feel the immune system is connected to how we feel in our brain? Does psychology, does that also affect our immune system?
Yes, I mean, the evidence is pretty clear. There's a whole branch of study called psychoneuroimmunology that looks at the finer intricacies of the nervous system with the immune system and the psyche, and they are intertwined. So if you have someone who's experiencing cognitive effects and it's coming out of nowhere, sometimes usually the mind goes first straight to that. Or they have a dementia, are they declining? Do they have Alzheimer's? Sometimes they have cancer. And we've seen that in our clinic, that once in a blue moon we'll have somebody come in who responds atypically to the treatments, and it turns out that they're unwell and they don't know it yet. The illness has not declared itself and they're having cognitive effects. And then that generally responds downstream to treatment. The treatment itself may gum up the works a little bit, but when they get on the far side of the treatment, generally they can be refreshed cognitively. And there's an area of study now called cancer-related brain effects, or people used to call it chemo brain. It's a real thing. For a long time they weren't sure whether it was just a subset of people who were vulnerable who might experience that, but it happens to a fair number of people.
Right.
And yeah.
I can attest.
Well, I mean, these drugs which save lives are also cytotoxic, and
Right.
we count on that. That's where the effectiveness comes from.
Right.
And but it's not a free lunch, and so sometimes the brain cells are feeling some downstream effects from the chemotherapy. But we find that people can be refreshed with that, and very often their functioning can be restored. So I've seen the most difficulties with children who were treated very young with chemotherapy and had cognitive effects. That's been the most difficult to work with. Sometimes there are learning difficulties and things that'll be downstream there, but they live and they are able to make a good life.
Yeah.
And are you able to help with your neurofeedback? Whatever you guys do.
Well, yes, that's
Are you
what
able to
I'm
help
saying.
with that, though, or are you
you can
still-
be helpful, but it
It
just
doesn't get them back.
It depends on the person. It depends on the treatment that they received, and it depends on the age at which they were treated. And my best friend's mother, when I was a child, when I was in the 8th grade, she was diagnosed with breast cancer, and she went on to have 2 recurrences later. So she lived to be almost 80, but she had cancer 3 times, or rounds of treatment during our lifetime. And so, the treatments have evolved so much over time as well. What she got when I was in the 8th grade is not the same thing she got when I was 40.
Right.
And you never know what can happen for people. And I try to say, okay, let's think about this. We can explore it. Let's see what can happen. And if somebody's not responding, then we wouldn't continue. But if somebody's getting effects and they're making progress, then if it feels worthwhile to them, of course we'll continue with that.
Good.
What other words of wisdom do you have for anybody?
Words of wisdom.
Yeah.
I want people to know that life with cancer can be okay. And sometimes life with cancer can even be good.
It is.
There's many blessings that have come to my life through this process. I know that. But
Yeah.
I know when you suffer from a terminal illness, you do start to have to take your own self into control. You know, you have to deal with your own anger issues or the emotional issues. And because if you're not dealing with your emotional issues, it doesn't seem like we heal as well. So you
Right.
gave us two different types of ways. One was a physiological way to keep us healthy, keep us with the anxiety and depression. And the other was techniques to help us with, you know, so chemo brain and cancer mind.
Yes.
So thank you for the help. We really enjoy it.
yeah.
Well, I've enjoyed being here with you today.
Thank you ever so much.
Yes. And where do you have a website?
I don't have a website at this point,
Okay.
but I do have an email.
Okay.
It's psychologics@yahoo.com. So psychologics @yahoo.com. I know that's a mouthful, but I think you'll post it in the resources
Yep.
at the end of the
Definitely.
program. So I'm happy to respond to emails.
Perfect.
People going towards you.
Great
Thank you so
resource.
much for being on the show,
Yeah.
and we'll have you on again.
Thanks for having me.
Thank you, Dr. Merrifield.
Bye.
And join us again for another Candid Chats on Cancer.
Thank you. You all be well.